Hello there, my name is Peta Tehan and I'm a podiatrist here in Australia. I've been a podiatrist for over 16 years now, which seems like a really long time, but you know what they say, time flies when you're having fun. Many of you probably have a podiatrist who assists you with your foot care. So general foot care, which is the care of nails, callus, corns, ingrown toenails, and any kind of general dermatological issues, things like tinea even. It's a really large part of our work. And it might seem menial to some or simple, but general foot care is an extremely important part of keeping people mobile and independent. And behind this simple task is a whole heap of clinical reasoning that you might not be seeing. So whilst the podiatrist is resecting your ingrown toenail, for instance, they're considering your blood flow, your comorbidities, thinking about potential toenail surgery, and if you're a good candidate, the medications you're taking, and if they interfere with wound healing, the list goes on and on. But beyond general foot care, podiatry is extremely diverse. And many may think, oh, it's just a foot. How could so much possibly go wrong with a foot? And I'm sure if you've ever experienced foot pain or any foot issues, you'll know for sure that your whole body hurts and you can't do anything if you've got foot pain or foot issues. And of course, that foot is attached to a person, and you all know that people are complicated. And many medical conditions can manifest themselves in the feet. So much of what podiatrists do is commonly detecting the first signs of some conditions like diabetes, for instance, or even inflammatory arthropathies by noticing these changes in the feet. When I first graduated as a podiatrist, I worked in a rural private practice. And this meant we were essentially the only podiatrist within a few hundred kilometres. So essentially, we saw absolutely everything. We were sort of like the general practitioners of podiatry. So we needed a really wide base of knowledge to manage all of the different conditions that would walk through the door. Pun definitely intended there. I looked after feet throughout the lifespan, so from babies all the way through to the elderly. I'd see things like ingrown toenails, toe walking or in-toeing, so we used to call that pigeon toes, we don't call it that anymore, flat feet, teenagers with growing pains, and then adults who worked in industry. So where I was there was a big aluminium smelter. So we'd see lots of occupational foot injuries and managing people with work boots and working at really high temperatures. So that was really interesting work. Lots of people with footwear issues, all the way through to sports people, people with diabetes, with wounds, and of course the elderly. I did things like manufactured orthoses or special insoles to help manage foot pain. I prescribed rehab programs, so helped people with stretching, strengthening, managing load in athletes. I altered footwear. It was incredibly diverse and I absolutely loved it, and stayed in private practice for a number of years before moving into the public hospital system. So in the hospital, podiatrists have a slightly different scope of practice or focus. So we predominantly manage acute complications, and predominantly to do with diabetes or vascular disease. And these can be conditions like Charcot-neuroarthropathy, which is where a person with a severe loss of protective sensation, so they don't have that gift of pain, can develop multiple foot fractures and the bones become very soft. Most of the time, in terms of what we're doing in the hospital, is managing people with tissue loss or ulcers, which require complex management because they're a complex presentation. So we do things like offloading, where we remove pressure from the site. This can include the fitting of cast walkers, casting people's feet in plaster casts. Maybe we'll add felted foam to specialist footwear, medical grade footwear, or special wound healing shoes, and maybe we'll prescribe special appliances to assist, like knee scooters, or have someone non-weight bearing for a period of time. The other main responsibility is managing the wound care. So podiatrists will debride or cut hard or dead tissue away from the wound to encourage healing. Most of the time it's not painful because people don't have pain. And then we decide on appropriate dressings and management to try and expedite that wound to healing. I happen to be a podiatrist with a special interest in vascular disease, and I've devoted the last 10 years of my professional life to doing research in this space and also training other podiatrists to identify arterial disease early so that it can be managed and we try and prevent some of these complications that we see. So a typical day in my clinical life involves an early wake-up call to round with the vascular surgeons on the ward in the hospital at 7 a.m. And I have to say, it's not always easy to get up, especially in winter. But together we devise appropriate management plans for our vascular patients. And in this capacity, I assist with pressure management, but I also give advice on wound care. And sometimes I also measure blood flow to people's feet by looking at their toe pressures. Yes, that's right, toe pressures. Did you even know that we could measure the blood pressure in your toes? Amazing, right? So hopefully I've given you some insight as to what we do as podiatrists, and you can see it's much more than general foot care.